morning, Farnham Road Surgery. You're through to Gergen. How may I help you?
Okay, so bring him in today at 3, all right?
I literally feel like I've been hit by a bus some days.
Have you been eating?
Yeah, I had a big fat kebab and everything, so I was all right.
Go to the toilet a few times a day. And when I gotta go, I literally have to go.
What, it's stand back, I'm coming through?
Yeah, like if anyone's in there, they gotta get out.
The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards.
I've got a 33-year-old lady who's been diagnosed with gestational diabetes. Most of her readings are high.
Are you using any contraception at the moment?
I'm a lesbian, so...
OK.
Yeah.
All right, so you don't need any contraception cover?
No.
Can I just tell you a good joke?
All right, go on then.
So there's a nightclub and there's a fight in this nightclub. And this blonde comes out covered in blood.
Hello, Farnham Road Surgery. Nikki speaking. How can I help?
Mr. Bunting? Hi. Sir, come in.
About 2 weeks ago, I got a little black lump underneath my tongue.
Right.
I just want to find out what it is.
And it's stayed the same since you first noticed it?
It's got a little tiny bit bigger, but it's not massive. It's just...
OK, I'll have a look. It's just the light.
Oh, right.
OK? So if you open your mouth. Right. And it's not causing you any pain? And...
I'm a bit worried because I had a tumour took out there.
OK.
So how can I help today?
It hurts. I had labour and it's worse than that.
OK, worse than labour?
Yes.
That must be the worst thing imaginable then. I can't imagine anything worse than labour.
It hurts. My stand up is easier. It starts from there,
Yeah.
goes round,
Uh-huh.
down there, and to there.
OK. And that's been since...
Tuesday.
Did it come on gradually on Tuesday, or did you suddenly...
No, I just woke up.
You woke up with it on Tuesday, and it was like that? You hadn't done anything on Monday that might have caused it?
Nothing, no.
You weren't out digging the road, or...?
No, I was behaving and I wasn't swinging from any trees and stuff.
Right, not...
No.
OK, yeah.
Took 2, what are they, naproxen, and I took 4 paracetamol.
Took the edge off it, didn't touch it?
Nothing, no.
Nothing? And pulling your wings OK?
It's fine, yeah.
OK. Right, let's have a look at your leg then. Well, wait, back first of all. Just stand up for me. I can sit down. That's OK? Yeah. OK, can I lift this up?
Yeah.
OK, so whereabouts does it hurt?
There.
There. OK. Does that hurt?
Yes.
Oh, well, yes then. Does that hurt there?
No.
But that hurts that side there?
Yeah.
So all the way across there?
Yeah.
And then down here, does that hurt?
No.
OK, so can you touch your toes? How quick can you get? My glasses.
There.
OK, how far back up can you come? How far back?
Oh, no.
No?
No.
Can we lie you on the couch? I just want to lift your leg in there. Is that OK?
You've got a step in.
Got a step. I'll give you a boost if you want.
OK, one moment. Bear with me.
And you did mention that in the past you'd had to have something removed.
They called it a warfarin tumour. W-A-R-F-I-N. Warfarin.
Wartin's tumour, there we go.
Oh, it's got a T in it, has it?
OK, so I'm just going to go in and just sort of feel this area that you mentioned. When I squeeze it, it almost seems to disappear in terms of the colour, and then it returns. It almost feels like a blood vessel in the area.
That's what the wife said.
Did she?
Yeah.
OK.
And I thought it was going to disappear on its own, but it hasn't. And I'm just a bit worried as to what it is. But...
OK. I mean, even the thing you had before was a benign sweat thing, and it wasn't sort of a cancerous thing which could potentially spread. So I don't think there's any association between this and what happened before in 2005. Can I just check the glands in your neck just to see if there's any enlargement? It's fine. And you've been well otherwise?
Yeah.
Any weight loss at all?
This is it, yeah. I've lost quite a bit of weight. The wife says it's down to eating better, but I don't know. I mean, I haven't lost an appetite.
Has she changed your diet?
And she's retired now, so It's a lot more healthy food.
Can I check your weight? You can leave your shoes on if you want. It won't make it.
I would do, but they're still toe cap. I think
sometimes.
I think I've gone down to about 15 stone or so.
It's actually the same.
The same?
As what it was in January.
Oh, it must be the scales at home then.
Going back to your this thing under your tongue, personally, I would say I don't think it needs removal at this stage. From my estimate of looking at it, it measures about 2 millimeters in diameter. If it doubled its size, I would want this to be looked at a bit further. But I think we can watch and wait for now.
Nothing to worry about then.
No. Okay?
Yeah, that's fine.
All right.
Okay.
Take care. Bye-bye.
Thanks very much.
See you.
Bye.
Is that hurting?
Yeah.
When I do that, where does it hurt? In the back. How does that make you feel when I do that?
Oh, yeah.
Makes it worse, yeah?
Yeah.
That's Benjamin there. Is that okay?
Yeah.
Okay. Should I sit you up? Okay, just swing your legs around. Just come have a seat.
Oh, what have I done?
Okay, right, so this feels like the muscle in the back. It's a very common thing. It's the commonest cause of backache probably is the muscles. And being as we are upright on 2 legs, and so 50% of us will get backache at some point, and often we don't know what's caused it.
No.
Yeah. As uncomfortable as those chairs are, you need to sit in an upright chair, not in a lounge chair, because it curves your back. The treatment is not to lie down and rest. The treatment is to keep mobile, but not to bend and not to lift. The warning signs of backache are numbness on the bit of your bottom when you sit on the bicycle saddle, or if you can't wee, or if you're incontinent to poo. That's that's what we call a red flag. That's straight to hospital. Don't pass go. Don't collect any money. Just go to hospital. So, shall I give you some cocodamol, which is codeine plus paracetamol?
I'll take anything.
Will you?
To get rid of the pain, yeah.
Okay, so you can take naproxen with these, okay, but you can't take paracetamol with them. Keep moving, and it's not better than a week, probably be seeing you again, but if you've got those red flags.
I will do, I will do.
Nice to see you, take care. And you, all the best. Bye-bye, Sue. Bye-bye.
Hello. Bye-bye.
Hello. How are you?
Hello.
Hi.
How are you?
You did it again. You did the weird hello.
Oh my God. They keep moaning about my hello. Was it that bad? Did you like my hello? Hello.
Hello.
Who comes out? Hello. That's not my fault, is it?
Are you okay?
How are you?
Yeah, not sure bad. Okay.
Good, good.
It's all right.
Well done for coming to see me.
Okay. Blood test or?
Yes, completely. I was going to call you, but then I realised you had an appointment with me, and I thought I'd wait and see to see if you attended. So this is your cholesterol level. It's 5.7. Okay.
Is that low or?
That's high.
Is that high?
But this particular type of fat, it's called your triglycerides, is really high.
Mm-hmm.
The normal range is 0.45 to 1.82, and yours is 7.6.
7.6.
But 2 years ago when we spoke to you,
Yeah.
it was 14.
14 was
So
it?
it has come down, but it's still really high.
Yeah. Sometimes, I've been to the parties, things and drink and eat too much, mutton or fat food.
Okay, with this particular type of fat, called your triglycerides, if it's really high, you're at risk of causing inflammation to your pancreas, which is the organ which secretes insulin, okay, which controls your blood sugar levels. So we do worry about it, okay? How would you feel about starting some medication? Because this is all a risk factor for heart disease, putting you at increased risk of developing a heart attack or a stroke.
Oh, it's lovely blue.
I looked out the window and I thought, maybe not black today. Come and sit down.
You're looking very lovely.
Love your hairband. Very pretty.
Cereal.
Where are all these badges from? You should collect them.
There's about 60 on it already.
I love your T-shirt, by the way. I wish I could wear T-shirts like that. Yeah.
I love your blouse. It's lovely.
It's lovely, isn't it? £4 eBay.
Really?
I just thought 32, 34, that'll do me. As long as it covers my big swollen arms, I'm happy.
You need to understand that this is putting you at completely high risk, and we need to try and control it and bring it down. So yes, your diet is really important. You need to cut out the fatty foods. You need to cut out the fried foods. Try and do some more exercise.
Yeah.
Do you smoke? Remind me.
No, I'm cut down now. Sometime. smoke 1 or 2 a day.
Okay, and how much alcohol are you drinking?
It's nearly quarter bottle like that, quarter cup bottles, whiskey like that.
Sorry, a quarter bottle?
Yeah.
Okay. For you, because your levels are so high,
Mm-hmm.
I think you need the help of medication as well. Are you willing to give it a go?
Yeah.
Yeah?
Oh, yeah.
Okay. I want to start you on a low dose to make sure you see your body gets used to them. Okay, and then we'll do a blood test in, say...
6 months? Oh.
Yeah, in 6 months' time. Okay, to see how you're getting on with them.
Okay. Thank you, yeah? Take care.
Bye-bye.
Bye.
Right, I've just seen Dr. Bolger, and she had agreed to give me a prescription. She forgot to give it to me, and I forgot to ask for it.
Might be in her room. Okay, I'll go and get it.
Thank you.
I'll go and get it for you. Hiya, Mr. Harris. Just going to take his prescription.
I've forgotten his prescription.
Thank
yeah.
you.
Thank you.
Mr. Harris. Where's he gone? Where's he gone now? How are you? I've lost a patient. Where's he gone? Lost a patient. Mr. Harris. Thought I lost you. What's the address, please?
Thanks for coming in. Is it because we've been pestering you to come and see us?
Yeah. Basically, you said I had to come and see you before you could issue me a sick note.
Yeah, because I wanted to see you, catch up with you and see how you are. Yeah.
Well, I'm not too bad, to be honest. I'm still like a little bit depressed and I'm not getting no help from nowhere. And like my Crohn's disease is still the same, but I ain't getting no help because I can't take tablets. So it's not getting no better for me.
Okay, so talk me through not being able to take tablets.
I went in hospital, I had pneumonia, like I never took tablets before that, and they tried crushing them up, everything, and I just kept throwing them back out, just won't go down. Like, it's just a thought of it.
It's a psychological thing.
Yeah, I don't know why as soon as it goes in my mouth, I just throw it back out. Like, I got so bad they had to like operate on me to get the fluid out of me. I had to use like a drill to drain to like my lung and take the fluid out that way.
So this is having a big effect on you then? You're not getting better because of it?
Yeah, no.
So tell me how your Crohn's disease is, as you're not having any medication.
Well, that's quite bad, to be honest with you. I go to the toilet like a few times a day. And when I got to go, I literally have to go.
What, it's stand back, I'm coming through?
Yeah, like if anyone's in there, they got to get out.
Okay. And is it loose?
It's never been like solid, it's always been like water.
Okay.
And it stinks.
Yeah, okay. And any tummy pain or?
No, not really.
No? And how's your weight?
Before I had the operation, I used to be like 16 stone, I used to be pretty big, and I went down to like a stick.
And can you tell me about your diet? I mean, do you have to watch what you eat, or can you?
No, I don't. I can't eat dairy products or anything like that. I've been told that much, but I ain't been told nothing further than that.
Have you seen a dietitian?
No.
Right. Okay. Would you like to?
Yeah, I would. Yeah.
Okay. And then you said about your mood.
Been an ongoing problem, and like I don't have any motivation to do anything. Even like when it comes to having a conversation with someone, like I find it hard sometimes. I don't know what to say in that.
Okay.
I just gone really low, like low esteem, I suppose.
Do you feel bad about yourself?
I do sometimes. Like I get like bad thoughts about myself, but not all the time.
Okay. What are these bad thoughts about yourself?
I don't know. I just like feel like not wanted and stuff like that.
Like not wanted.
Yeah, like things like that.
Lily Ellis. Hi, morning.
Hiya.
Okay.
Okay. I'm going to Greece on Tuesday.
Okay.
And I'm due on my period that day.
Okay.
And I just wondered if there's any tablets you could give me just like the pill, just while I'm away.
Okay.
Because I don't really want to be in Greece.
Where are you going?
Crete.
Nice. How long are you away for?
2 weeks.
Okay. So when was your last period?
The end of last month. So I'm due on.
So you're due on any time?
Yeah.
And can I ask, are you using any contraception at the moment?
I'm a lesbian, so.
Okay.
Yeah.
All right, so you don't need any contraception
No.
cover?
No.
Excellent. All right. So in that case, and because it's such short notice,
Yeah.
there is something that we can give you.
Okay.
You're going on Tuesday, did you
Yeah.
say? Okay, so I would probably start taking it on Saturday.
Okay.
Okay, just so
Yeah.
that you take it 3 days before you're due to
right,
start
yeah.
on. And then take it for the time that you're out there, and then you need to stop as soon as you come back, because we don't normally give it for more than 2 weeks.
Yeah, that's
okay,
fine,
that'll be
yeah.
slightly there. For now, this will be okay, and you
Yeah.
don't need to worry about contraception,
No.
so that's okay. I prescribed norethistrin for Lily, sometimes known as a period delay tablet. Norethistrin is a synthetic form of the female hormone progesterone, which is responsible for maintaining the lining of the womb and prevents it from being shed. So this medication can help women that want to delay their period for some time. It can also help women who suffer with heavy, painful periods. It can have some side effects, such as bloating, nausea, breast tenderness, and it can also have an effect on women's cycle after they stop using it. The tablet is not known to have an effect on ovulation or the fertility of a woman. So when you come back and you start your period, things may be a bit abnormal for a couple of months. That's just the effects of the hormones and the pills.
That's fine,
okay, so don't be alarmed.
Okay, that's fine.
So start taking this from tomorrow.
Okay.
1 tablet 3 times a day. Okay.
All
Have a
right.
great time.
Thank
All right,
you.
See you then. Bye-bye.
Do you feel like hurting yourself?
I did once, like on my arm there,
Uh-huh.
but that was about 4 or 5 months ago.
Okay. So nothing recent.
No,
and,
nothing
and any thoughts about committing suicide?
No.
Okay. Do you drink alcohol?
Sometimes,
Okay.
but not all the time.
So how often do you go out for a drink?
Well, I've been out for about 2 months.
Okay. Do you smoke?
Cigarettes, yeah.
How many?
About 10 a day, 11. I'd love to stop because it's so expensive, and
Yeah.
but I just every time I try, I get 2-3 hours into it, then I have to start smoking again.
What? Okay. Would you like some help with that?
Yeah, I would.
Okay. So I arrange you to see our smoking cessation clinic here.
Yeah, that'd be good.
Okay. And do you use any illicit drugs, cannabis or anything
No.
else? No.
No.
Okay. Right.
I couldn't afford it.
Okay. On the scales. No. Okay, that's 75.
How much is 75?
That is about 11 3/4.
Oh, that ain't a lot, is it?
So I'm much, as a doctor, for your height, happier with you being 11.5 stone than 16 stone. And then I wonder about getting you to go and see talking therapies to A, look at your depression.
Yeah, they were going to send me to that.
But also to see if we can help with this not being able to take medication issue.
Yeah, that's a big issue.
Okay, so that's 3 things. No, 4 things. Dietitian, smoking,
Yeah.
talking therapies, and gastroenterology. Seen okay, Michael?
Yeah.
You can read my scribble. Okay, thanks for coming in. Okay, take care. Bye-bye.
I've got sausages, I've got sausages.
She went, baked beans. I want to sing now. Because you maybe want to sing, but I don't want to sing. What sing? What sing? What song? What sing we singing?
Wheels on the bus go round and round, round and round, round and round.
Now, it's time for the appointment.
Come on in, Maria.
Thank you.
Through. So, I saw you last week, didn't I? Last week before?
Just over, yeah, week before.
Doesn't time fly when you're having fun?
It certainly does.
And we did loads of bloods, didn't we?
We did.
Because you're struggling with your back and I'm struggling with your back, yeah?
I'm struggling with everything. It's not even just my back. My toes hurt, my arms hurt, my shoulders, my collarbone, you name it, and it hurts.
Maria has been having problems with her back since the late 90s. She's seen physiotherapists, she's seen pain clinics, and she's seen orthopaedic surgeons. She's had repeated scans which have shown some disc damage and more recently some wear and tear of the facet joints. In 2013, the surgeons tried a decompression, which is where they took the disc out and they fused the vertebrae. But unfortunately for Maria, it hasn't really worked. I did some bloods to look at how your immune system was working, and one of them was just a little abnormal. Nothing. The lab are basically saying we don't know if that's anything to be concerned about or not.
Yeah.
And it should be repeated in 3 months. There's certainly nothing that's jumping out of those bloods, but we can't leave you like this, can we?
No.
Maria has been diagnosed with fibromyalgia. Fibromyalgia is a collection of symptoms. It's a syndrome. To diagnose it, it really needs to have been going on for at least 3 months. Patients report widespread pain, tiredness. They also have problems sleeping, and they describe memory problems, so difficulty in thinking clearly. It's moved from just your back, which is where we just
I
to send you
literally
to.
feel like I've been hit by a bus some days. I can't sleep. The pain is waking me up. I'm miserable.
There are two options, I think. The first is to get you off to see a rheumatologist to explain that things have changed and for them to check that they don't think there's anything that we're missing that we should be treating. I may well have to go back to the pain clinic because I'm struggling to think what else we can use.
Whatever you recommend, I'm happy to go with.
It's very frustrating, very difficult when you see a patient whom you've worked through all the usual treatments that you would offer for their pain and you're really not making any impact on it. It's very distressing for the patient and very disappointing for the doctor.
Everything hurts. Fed up with moaning. My lot I must be driving them insane.
Hi, how are you?
Okay, I don't know if you had the A&E report. She fell back onto the floor while she was playing with her dad off the sofa. I can't even remember how long she was actually not breathing for. She went blue, rigid, and fell. And then a couple of weeks later, she did it again.
Okay, so what?
But it wasn't as bad.
What happens?
You know when you're crying but you don't take a breath?
Yeah.
She just didn't breathe. She went blue.
How long does that last for?
It felt like it was forever, but I think it was probably 5 minutes, the whole process. When she did come around again, she was slurring, she was still woozy. But once she made it to A&E, within like half an hour of being in A&E, she was back to normal again.
Right. And that was that one episode?
That was that one episode. Then it happened a couple of weeks after. She went from her room to her brother's room, slipped on the floor, and her brother went off on her. And I was like, what's wrong? What happened? But Safa's not breathing.
Wait, did you see that long breath pause or anything? Or was it
No,
just
but her brother saw it.
Okay.
I know he's only 4, but he's quite aware, because he was there when it happened the first time.
Okay. Did she actually go blue the first time?
She went blue, lips, face, everything was just blue. It was horrible.
I want to hand in these.
What is it?
This is really. Sorry.
What? I'm excited. I have it today.
Is it open?
My car's okay.
Yeah.
That's all right.
I've got some special things for you.
What's
Because you're living.
Oh,
You want that? He's not
Oh,
naughty.
thank you.
So what you're taking at the moment?
Gabapentin. Can you actually do my prescription for me while I...
So you're on
Gabapentin.
duloxetine, gabapentin, amitriptyline.
I'm not taking the duloxetine.
You didn't like that, did you?
It gave me really bad nightmares and made me sweat like a workman.
Okay.
It wasn't pleasant.
So let's get rid of that.
I tried. I couldn't persevere with that one.
No, that's fine. Have you been on patches?
No.
That's another option, isn't it?
I'll try anything at this point.
When did you do the talking therapies pain management stuff? Was that recently?
No, it was quite a while ago.
Right, but you're happy with it? You know what you're doing with it? They give you sort of exercises.
Yeah,
and things,
you
don't they?
get exercises. To be honest with you, I think the psychologist, I can't remember, is it psychologist?
Psychologist, yeah.
I don't think she liked me very much.
Why?
Because she kept talking about think positively through your pain. And I was like, I completely understand what you're saying, but with all due respect,
When it's
if
bad, it's
I've got a physical problem causing the pain, all the positive thinking in the world isn't going to take that away. And because she couldn't argue, I don't think she liked me very much.
Sure she did, but yeah, I mean...
But no, I get all of that.
The results were good. Prescription's gone. We'll wait and see what the rheumatologists think.
Okie dokie. Yeah, great. Thank you very much.
No problem.
Have a good day, and you.
Bye-bye.
Bye-bye.
How are you feeling, sweetheart?
I'm all right.
You weren't looking good at all.
I ended up with shingles.
Oh, God, that's so terrible.
Yeah.
Poor kid.
That was like 4 weeks ago.
Oh, no. That's the worst. That's
How
a
are
love.
you getting on?
And Rosie said fish in my car just packed up today.
All right, sweetheart. No problem, darling.
No, it sounds like this could have been what we call a breath-holding attack, okay? So sometimes what happens is kiddies can hold their breath, go blue,
and it can be very, very dramatic and obviously quite distressing for the parents. There are two types of breath-holding attacks, and they're divided into blue or white. Blue breath-holding attacks are far more common and essentially occur when the child is in pain or frustrated or angry. The lips may go blue and they lose consciousness. With white breath-holding attacks, they're also known as reflex anoxic seizures. It usually occurs after a sudden fright or a sudden onset of pain, for example, a minor head injury. They will go pale, limp, and there will be loss of consciousness. Occasionally, they also look like they're having a seizure where their limbs will go very firm and there can be some shaking movements. What I'm going to do, I'm going to examine her, of course, now. What I'm going to do is I'm going to put you into my colleague who's essentially got a specialist interest in paediatrics. I'm going to get her to review and make sure that she's happy with the history as well. Does that make sense?
That's fine. I just want to check there's nothing long-term.
Absolutely, absolutely. No, of course. Pop her on your lap for me.
Don't want to go and sit on my lap.
Okay. And lift it up right up for me. Let's have a listen to her chest. Spin her around for me. Good, okay. So since the third, she's been back to her normal self, running around, playing active, no concerns?
Yeah.
Good, okay. Breath-holding attacks are not a sign of anything more sinister. However, occasionally they can be confused with epilepsy, which is why it's important to seek immediate medical attention if something like this occurs. If, of course, an episode recurs, you've done absolutely the right thing. I'm sure in A&E they showed you the basic things that you should do. So if it does recur, make sure you seek immediate medical attention. All right? Lovely. No trouble. All right, bye-bye now.
Your lights are on.
Thank you.
No worries. And that's good observancy.
Good observancy. Is observancy a word, though?
I don't know.
I bet you used to say millennium as well, didn't you?
Who?
Millennium for the millennium. Millennium.
Yeah. Can I help you?
OK, come in. Have a seat.
I've been given these tablets.
Yeah.
And these. And I'm also taking citalopram. But I haven't been given, they haven't been put on my repeat prescription.
Okay.
So I haven't taken them for a month.
Which one have you not taken?
Both all of them.
Right, OK. Whilst you're here, it would be an opportunity to just check if anything's changed since you were last seen.
No, nothing's really changed. It's just I just don't like.
Because you used to take olanzapine.
Yeah,
now you're on this.
Yeah, I'm on that.
And do you think there's been any improvement?
There's been a little bit of improvement, but as I said, I haven't had them for about a month now.
Okay.
And everything, I'm getting all these thoughts back in my head.
Right. Robert suffers with schizophrenia, particularly psychosis. He suffers with symptoms of hearing voices, as well as symptoms of feeling quite low and depressed. This has developed during his 20s. He was someone who was functioning quite well. He held various jobs during his life, but unfortunately he went through difficulties. He wasn't able to function. So he started an antipsychotic medication. During the time he was on the medication, he became type 2 diabetic. OK, if you ever get into a situation where your medications aren't there, and, you know, they say there's no appointment, somehow or another we need to contact you even on that day so that at least we can sort it out. And usually we can see you even as an emergency or do it over the phone. And then with the diabetes side of things...
Last week, when I had a hypo, my blood sugar level was at 2.4, and I checked it, and 2 hours later, and it managed to get up to 2.6.
And were you taking these tablets at that time?
No, I wasn't taking them. No. Because that's what I said. I run out of them. I ain't had them for a month.
And yet your blood sugar was low?
Yeah.
Did you feel unwell last week?
Well, I felt really ill last week.
Have you been eating?
Yeah, I've been eating.
Yeah?
I had a big fat kebab and everything. So I was all right. The next day, I woke up and it was just my blood sugar level was just as low as it was.
So we have seen in research that diabetes can be 2 to 3 times higher in prevalence in those with severe mental illness compared to the general population. Patients who suffer with severe mental illness are at risk of having poorer lifestyles. They tend to have poorer nutrition, partly because they have less income to try and afford healthier foods. And some of the antipsychotics can lead to a rise in blood sugars. So it is difficult for patients with severe mental illness. Do you drink alcohol at all?
Yeah, a little bit, but not a lot.
How much is it at the moment?
I drink 5 units a week, a day. Usually it's just 2 cans of beer that I have, and that's it.
What kind of beer is that?
It's a K-cider, which is 8.5% in volume.
Okay.
Sometimes I don't drink. I go days and days and days without drinking. Where I'll just drink. Where I'll just drink, literally just drink water.
Right. So you have some alcohol-free days.
Yeah, I have plenty of alcohol-free days.
Right. Good.
I only have a drink. I have a drink when I get paid, and that's it. Once every 2 weeks.
Okay. And what we will do, you're going to see your consultant, and I'd like to see you shortly after that. And then, obviously, the reason you came today, I must give you a prescription. All right?
Thank you very much.
Okay, see you soon. Okay, take care.
My daughter had an appointment at 9:30. Can I cancel that, please?
Right, now I need somebody to tell me how to cancel this, because I don't know how to do it. How do we cancel it? This lady needs to cancel her daughter's appointment.
It's going to be the easiest thing you ever do.
What did you press?
C.
Why did you press C?
Cancel.
I will get there, sorry. OK, have a seat.
Thank you.
Just check your oxygen levels. That's it.
I'd rather not have a bad chest. But
Yeah.
you're the person to see when you put me at ease, totally at ease.
Oh,
you
good,
do.
good.
I mean,
So-
the last time I was feeling a bit rough, and I've come out of here feeling all right,
Oh, good.
It's when I inhale the cold.
Yes, yeah.
It seems to do me no good
It
at all.
affects your chest. You're feeling up to the breathing test
Yeah,
today?
yeah. Well, I dread it, but you know what I mean, don't you? Got to be done.
And you don't smoke anymore, do you,
No,
John?
No. 50 a day I used to smoke.
Gosh.
Silly, isn't it? God
Feel
gave
it.
me a pair of lungs. I could run cross country. I used to box when I was
Boxing.
young. What do I do? I smoke 50 a day and destroy it all.
Yeah.
Crazy,
But,
isn't it?
you know, when you were young, though, nobody knew the dangers of cigarettes,
I
did
watched
they?
all my favourite film stars smoking, so I
Mhm.
thought if they're doing it, it'd be OK, wouldn't it?
And in the army, they used to give out the cigarettes, didn't
200
they?
a week I
Yeah.
used to smoke.
The first test is the relaxed blow.
Right.
Okay, so so it's big breath in, fill your lungs as much as
Yeah,
you can.
I'm just bracing myself now.
Tube in mouth, pinch your nose,
Yep.
and then just blow out nice and slow and steady. Okay, so fill your lungs. That's it. Tube. Tube in mouth, pinch your nose. That's good. Keep going, keep going, keep going, as much as you can. Squeeze it all out. Good, well done.
Was it good? I didn't think it was very good.
Well, we'll have a look at the results in the end. So the next one is the forced blow, where you blow out really hard and fast.
As long as I can, obviously.
Yeah. Okay, so it's big breath in, remember? So big breath in. Okay, really go for it, yeah?
Yeah.
That's good. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. As much as you can. Good, well done.
Was it? I thought that was rubbish. I'm doing the best I can.
Got a nice shade of scarlet when you're doing it. So we measured how much you blow out in 1 second. That was pretty much exactly the same as last year.
Yeah. Okay, good.
Your full lung capacity is better.
Really?
You blew better this year than you did last
Oh, that's
year.
brilliant.
Last year you blew 2.96 litres. This year you blew 3.24 litres.
Brilliant.
So that's good.
When I leave here, I'm going to have a run around the block.
So you've done better than you did last year. So that's good. Okay.
Is that it?
That's it, I
That's
think.
wonderful.
Yeah. If you do have any problems with your chest, just come in and ask for an emergency doctor's appointment, yeah?
Can I just tell you a good joke? It's perfect.
Okay.
It's an Essex joke.
All right, go on then.
So there's a nightclub and there's a fight in this nightclub, and this blonde comes out covered in blood. The ambulance arrives and the paramedic said, "Where are you bleeding from?" She said, "Romford." Thank you very much.
Very
It's
good.
an
Nice to
absolute
see you, John. Take care.
See you next year.
Yeah, take care. All the best. Bye-bye.
Yes, Dr. Hyder, come through and have a seat. And how are you?
Yeah, not very well.
Not very well. How can I help you today?
Last Tuesday, I had a phone call from Wrexham Hospital that I have got gestational diabetes. And since then, I've been checking my blood sugar, which is, results are not very good. And I phoned them this morning. I left a message at 8 o'clock.
Okay.
Nobody rang me back.
Okay. And are you on any medication? Have they started you on metformin or any
No.
medication? No. Is it your first pregnancy? Okay. So they're usually a bit higher than desired, aren't they? Gestational diabetes is a type of diabetes you get in pregnancy. It's when the pancreas is not producing enough insulin for the body's demands, so you get high blood sugars. The main risk to the mother and baby is that you get macrosomia, which is when you have a baby that is much larger than an average size. And the risk to the mother is that that will then be very difficult to deliver that baby vaginally.
Like last night, I just had salad in my dinner.
Yeah.
And it was 5.2, which was normal.
Yeah.
So this morning, I don't know why did it shoot up.
Yeah. It's sometimes just related to having the problem, gestational diabetes, and not because of what you're eating necessarily, because the pancreas is not sufficiently working, which is why it's not lowering the sugars enough. Sometimes you need to start some medication in pregnancy for that as well, and it's usually metformin. But what we can do is try and call the nurse now so she can see you if she's answering. Yeah.
Thank you.
How many weeks pregnant are you at the moment?
30.
30. Yeah, so it's the same again, answer machine. What I'll do is I'll speak to the obstetric doctors as well and just ask them if they want you to start on any medication. Hi, it's Dr. Hyder, GP calling. Could I speak to the on-call obstetric doctor for advice, please? Thank you.
Just take a seat there. Oh, sorry, is this Mum?
Thank you much. Oh, butterfingers. Ow! Pinch yourself.
Yes.
Oh, bless you.
I'm not crying.
Bye. Ow. Oh, bang me knee.
Right, how can I help?
Right, my problem is my toe. They sent me for X-ray.
Yeah.
It's come out as some arthritis. But after a whole day at work, I just find it very painful. It does hurt at night as well.
It's called hallux rigidus, is what it's called. And it's a stiffness of that joint. It can be made worse by wearing heels.
I don't wear heels.
You wear flats, yeah.
Because I work in the hospital, I'm always on flats as well.
And you're always on your feet.
Yeah.
Yeah. The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards. But that recovery period lasts about 6 weeks or so, after which you're left with a stiff, surgically frozen joint here, but it's not painful anymore. But you have to be willing to have that surgery. It's not something I would jump into without sufficient thought. Unfortunately, the only other things that help are icing the joint. People underestimate greatly the amount of relief that you get from icing a joint because there's inflammation in there, and the ice slows that inflammation down.
Okay, is it because I'm lacking something? Or?
I suppose it's really a relic of evolution. All of our weight bears down on our feet, and in order to walk forward, you have to spring off your foot, and that joint takes most of the strain from the spring, and that's why it happens. It doesn't happen to everyone.
I've had bloods done recently.
Yes.
And my HbA1C was it?
HbA1c, yeah.
Has it gone up?
Yes, it has gone up. Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and chocolate. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. I know they're hard to do.
I know at work, you're working all day long and then you want to treat them.
Have an apple. Have an orange.
I do apple and fruits. I love my
yeah, okay. Okay, so that's what you have, and I'd like you to read up on it on patient.co.uk.
Thank you. So just take the naproxen and do the eyes treatment like you've recommended.
Correct.
Oh, thank you very much.
All the best.
Bye.
Yeah. Bye.
OK, that's great. Thanks for your help. Bye. Yep, so they're not too concerned about the readings at the moment. They think that the diabetic nurse will be able to give you advice when you've done a few more readings. They would probably start you on metformin if you had around 3 readings above 7 before meals, which you haven't had. Gestational diabetes tends to disappear after delivering the baby. However, there is an increased risk of developing type 2 diabetes later on in life. OK, all right, so see what they say, and if you're still not sure, then you can phone us and speak to us on the phone as well for advice. All right, take care then. Bye-bye.
Hello.
Hello.
Nice to see you.
Yeah.
So how are you?
Oh, I'm okay. Mama.
You're looking well.
Yeah.
Yeah. What do you do during your days at the moment?
Today I went to Whitwell Day Centre.
And how often do you go there?
Every Wednesday.
Every Wednesday. And what do you do the rest of the week?
On a Monday, I go recycle teenagers.
You go and recycle teenagers?
Yeah.
That sounds fantastic. How do you recycle a teenager?
Drink a lot of tea.
You drink a lot of tea?
Yeah.
Brilliant. How would you describe your health?
A lot better.
OK. Can I ask how are your water works? Because in the past you've had the occasional trouble with those, haven't you?
I do wee a lot, you know.
We went on a trip last Friday and he was going to the toilet a lot.
Yeah, how about night time?
About 4 or 5 at night.
You're getting up 4 or 5 times at night?
Yeah.
That's quite a lot, isn't it?
Yeah.
Would you mind if I examine your prostate? Do you know how I do that?
Yeah, OK. Was that when you put your hand...
Do an internal examination in the back passage?
Yeah.
That's right, yeah. Is that OK if I do that?
Yeah.
It would be useful for me today to do that. Is that OK? Yeah. Would you mind popping on the couch for me then, and we'll do that for you?
Do you want me to leave the room?
That's fine if you want to stay. Are you OK for wanting to stay?
Happy you be here.
OK, but we'll draw the curtain round.
Yes,
OK?
curtain. OK.
OK, do you want to lie on the couch? That's it. Swing your feet up. Bit of jelly. OK. OK. Great, that's it, we're done.
Is it done?
That's we're done, yep. OK, that's it. Lovely. Do you want to get yourself dressed and then come out?
Yeah.
Is that OK? So you've got a tablet for your prostate and a tablet for your bladder to try and control that. So you're on the maximum treatment already, really.
Oh, OK.
You know,
But the prostate, you think, is just...
It felt completely OK examining you, just a
Yeah.
bit big. I think the problem is as much with the bladder being sensitive as with the
Yeah,
prostate.
because sometimes,
Yeah.
I mean, I know last time that, I mean, he wants to go, but it's not a lot.
Yes.
When we're out, we drink more, don't we?
Yeah, I try and cut back.
Yeah, there's always that wish, isn't there? Because you're out, yeah.
Cut back a bit, isn't it?
Yeah.
Well, thank you for coming.
OK.
It's nice to see you.
Thank you.
OK.
All right.
Thanks for coming. Nice to see you.
Nice to see
Take
you.
care. Bye-bye.
See ya. You're going to be all right.
I'm going to be all right. I've survived this long. Why not carry on?
Lovely, thank you very much, Doctor.
Bye-bye.